The first step in the consent process is to gather the paperwork to be used. Here are two examples of how to do this process.
Yes. Uh-huh. I can do that for you. Okay.
In this scene, we saw Dr. Smith getting the form without checking the dates and version. She could have easily used an expired consent form.
Uh-huh. Okay.
Here, Dr. Smith was careful in verifying that the form was correct. Another way to do this is to print the consent form directly from IRB to avoid any problems. In addition, it is important to verify that the person consenting the subject has been delegated the authority to do so by the PI. Furthermore, he or she must be listed on the study in IRB.
Mr. Jones?
Yeah, that's me.
You're Mr. Jones?
Yeah.
And you're here regarding a sleeping disorder study?
Yeah, that's right.
Okay, well let me go ahead and grab a consent form for you and I'll be right back.
I can't believe she did that.
That's not right.
The consent process should take place in a private area. Consenting the patient in a crowded area presents a potential breach of confidentiality.
Hi, are you Mr. Jones?
Yes, Brian Jones.
Nice to meet you.
It's my wife, Mary.
Nice to meet you too. Is it okay if I discuss all this with your wife present?
Yeah, that's fine.
Okay. Well, I just wanted to come and talk to you about participating in a study that we have going on here. And I understand that somebody's already given you a consent form to review. Is that correct?
Yes, and we've actually went through it over the weekend, and I think I'm going to participate.
I actually signed it for him yesterday because I handle all of the paperwork.
Even if the patient wants to sign right away, or if the family member has already signed the form, the person obtaining consent should review the consent form with the patient. Accepting pre-signed forms is not acceptable. If the patient is capable to sign the consent form, he or she should always do it.
Actually, it's my responsibility to go over the consent form with you and make sure that everybody understands the commitment and the risk and the benefits involved in this study. I know that's going to take some extra time, but is that okay with y'all?
Yeah, that's fine.
Okay, great. First, I want to make sure that you do have the disorder that we're studying here, that you do have a sleeping disorder.
Yes, I've had trouble sleeping for about a year now. I've tried supplements like melatonin, but they didn't work.
Okay. Well, we're actually going to be using a common drug that is used in stomach disorders. It's called Zantac, and we're not sure if this is going to work, so it is an investigational study. However, I want you to know that participation is completely voluntary, and no matter whether you participate or not, your medical care will not change and your relationship with your doctor will not change either, okay?
Mm-hmm.
All right, and we're also going to be enrolling 20 participants from this hospital.
The person consenting the patient needs to go through all the sections of the consent form, including the procedures, time commitment, and other details that could affect the patient's willingness to be part of the study, especially the risk section. It is important to describe the risk section in terms of percentages or ratio of the likelihood of experiencing one or more of the known side effects.
Okay, now that I've explained everything in the consent form, do you understand everything?
Yes, I think I get it.
All right, great. Sign here.
This is incorrect. The person obtaining consent should always give the subject and family enough time to ask questions and also try to verify the patient's understanding of the study by asking questions about the elements of the consent form.
So now that I've gone over the consent form with you, do you have any questions?
I don't. Do you, Mary?
I would just like to know how many times we have to come back after this visit.
Normally you'd have to come back twice, but this study actually requires 3 additional visits. Those will be covered by the sponsor.
The subject should be informed about what is going to be covered under the study grant and what is not. Subjects should understand if they lose health insurance, they will be responsible for the medical bill if it's not covered by the study.
Do you have any additional questions other than that?
Nope.
Okay, I just need you to sign here and here.
The use of a witness for VA studies is an optional requirement at the discretion of the IRB. Any person can serve as a witness to the subject's signature if one is required. For other places, such as the Winship Cancer Institute, a physician investigator is required to discuss the study and review the informed consent document with the subject. Please review the consent process standard operating procedure at your institution or department for more detailed instruction.
All right, let me go get you a copy for your records, and I'll be back in a second.
All right.
Investigators are required to give a copy of the consent form to the patient. It is good clinical practice to give a signed copy of the consent form to the subject for his or her records. Remember, the consent process needs to be documented in the patient chart or any other place where research information is being saved to the subject. For subjects who do not speak English fluently, the study team should get the help of a translator and use an IRB-approved short form or translated full consent form.
All right, here's a copy for your records. Here is my card with all my information on it in case you have any additional questions later. On this page is the contact information for the entire study team. And on the final page is the contact information for the Emory IRB in case you have any questions about your rights as a participant. Okay?
All right, thanks.
All right, well, thank you for participating in the study, and I will see you at your next visit.
All right, goodbye. We did it. We signed up.